wonderful to be here with your group today. We work just across campus from each other, but it's seldom that we get the chance to overlap. So it's great to be here today. As you said, I'm Danielle Glorioso, and I'm the Executive Director of the Center for Healthy Aging. And I'm also a social worker. So whenever I can, I try to sort of add my social work heart and soul into the work that we do at the Stein Institute. And one of the things I've been very fortunate to do as part of my work here in the Division of Geriatric Psychiatry is to be trained as a prolonged grief disorder therapist. Many years ago, we were part of a multi-site study led by Dr. Sid Zuzuk here in San Diego. And I was one of the trained therapists that got to do work on that study. And ever since then, it's been an area that is near and dear to my heart. So I'm delighted to be here today. And I will just say that the timing is fantastic because I am not an expert at all in prolonged grief disorder for caregivers, but I am participating in a panel at AAGP in a few months on this topic. So I'm not an expert, but I am now learning a little bit about it. And so this is a great opportunity for me to sort of start putting the pieces together. So my guess is many of you know more about this than I do, but I'm here and learning just alongside all of you. So I like this first slide, and I do it for a reason, because when we think about grief and loss, what we know is that we grieve best when we're not grieving alone. And so the role of a grief therapist or a supportive friend is to bear witness to somebody's pain, to not try to fix it, to not try to change it, but to just be able to bear witness to it. And so when I think about the work that I've done as a prolonged grief disorder therapist or a grief therapist, I think that my job is to sort of sit side by side with somebody who's struggling and suffering and to bear witness to their pain. And I feel as though this slide really feels comparable to what my sessions with my clients would be like. There we go. So today I'm going to be covering a few things. So we're going to be doing a high-level overview of what acute grief and integrated grief is. I'm going to describe to you what prolonged grief disorder is. We'll be talking about what some of the research tells us about risk factors for those who have been Alzheimer's and dementia caregivers in prolonged grief. And then I'm going to be going over what prolonged grief disorder therapy is. So we have a number of things to cover today, and I'm excited about it. So I want to just start with show of hands, maybe with your raise hand function. Are any of you familiar with prolonged grief disorder? If it's yes, just raise your hand. Okay. Okay, a few of you. Okay. So this is what's always so interesting to me. So prolonged grief disorder, or formerly named complicated grief, is something that has been studied and been around for decades. It was only recently entered into the DSM, but it has been around for decades. And yet still there are so many people working in mental health, in psychiatry, clinicians, psychiatrists that have not heard of prolonged grief or are not familiar with prolonged grief. So whenever we can, we want to try to sort of spread the word and help educate people about it, because it's still one of those things that is not yet well recognized. And so for those of you who haven't heard about it today, I'm glad that I'll get the chance to teach you a little bit about it. So let's start with, the big picture view, which is that grief is universal. If we live long enough, hopefully, if we live long enough, all of us will experience the loss of someone that we love. But yet how we understand it is not universal. So if you just do a quick Google search of what is grief, you'll find that there are all different shapes and sizes and views of grief. What is grief? Stages of grief, how to view grief, ways to approach grief, cultural views of grief, different ways that genders grieve. There's just so much out there about grieving. And so that sometimes can feel a little overwhelming. It can be confusing for a griever. And so in the work that we do at the Center for Prolonged Grief, we try to keep it simple. So the definition that we use is that grief is a response to loss. Okay. And so what that means is that it's a complex experience, and it's the form that love takes when someone dies. And it's important to recognize that grief is permanent. Grief is something that will find a place in us for the rest of our lives. So our job is to not get rid of grief, to find a way to, move away from grief, Grief is forever permanent when we lose someone we love, but yet it's forever evolving and changing. It's universal in that all of us, if we live long enough, will experience it. And there are some recognizable features, but yet I like to say it's like a thumbprint. There are no two that are exactly the same. And there are as many different ways to grieve as there are people grieving. And so it naturally contains a lot of mixed feelings and thoughts and can be overwhelming, challenging, and confusing as we move through the loss of someone that we love dearly. And so, as I mentioned before, grief does not completely go away, but it does change and evolve over time. And so the way that we think about grief is there's sort of acute grief, it moves to integrated grief, and when it doesn't move to integrated grief, it can become something that we call prolonged grief. So when you think about acute grief, so this is the initial form of grief that happens right after we lose somebody that we love. So it tends to be heightened, intense, overwhelming, dominating the mind of a bereaved person. If you imagine if you've had a loss yourself, or if you have somebody close to you that's lost somebody, think about the first 6 months after the loss. It's a roller coaster ride, maybe difficulty eating, sleeping, focusing, concentrating, doing basic tasks might be difficult. Going to the grocery store could be overwhelming. It's sort of this really heightened state of grief, challenges, all of these things. And so that's what we would call the acute phase of grieving. And then in time, as we move through what we call the mourning process, the mourning process serves as actually a really important time for grievers, as it's a time for us to sort of adapt to this new reality and come to terms with the new reality. So coming to terms with the loss is really what is happening through the mourning process. And as we are working through that phase and coming to terms with the mourning, with the loss and the realities and all that entails, we move into what we call an integrated form of grief. So this is not where grief is gone. It's just where the grief is perhaps quieter at times and sort of holds a space in our lives that's a little more manageable. I like to think of it as it's like the acute grief, the sharp edges have been dulled a little bit around the sides, so they're not quite as sharp. They're still present, they're still there, but they aren't the overwhelming force in our lives. You know, we've probably gotten back to being able to go to work, being able to concentrate, hopefully engaging in meaningful activities again. All the while being a different version of ourselves, not exactly the same as before, but being able to integrate into our life again and sort of come to terms with this new reality without our loved one. But for a certain percentage of people, that does not happen. And there's something that gets in the way of that integrating process, and the process gets derailed. And we can move into prolonged grief, which is this heightened state of grief that does not get better with time. So the whole concept of time heals all wounds does not apply to those who develop prolonged grief. They can have a form of grief that is persistent, preoccupying, and impairing, and can last indefinitely. And in fact, through the course of my career, I've seen people that are 15, 20 years since the loss, and they are in this heightened state of grief indefinitely. So 15, 20 years since the loss, and they are still grieving as if it happened yesterday, difficulty getting back engaged in life, not seeing friends anymore, perhaps no longer working anymore, sort of not going back to the things that they once loved. So really this heightened state of struggle and challenge that generally those with prolonged grief do not get better on their own. It does require some form of treatment, which I'll get into in just a little bit. And so many of you probably already know this, but you've heard about the stages of grief by Kubler-Ross. And so when we think about understanding grief, it's really important to sort of think about the fact that grief does not progress in stages. It's not prescriptive. Again, it's not one size fits all. It doesn't move in this sort of nice linear fashion. It tends to be the mourning process, and the adaptation tends to be up and down, left, right, back, forth, 5 steps forward, 20 steps back. It's not neat and tidy. And it tends to be sort of an oscillation between difficult emotions and perhaps not. And so we like to make sure that our clients especially know this, that we shouldn't expect things to be linear and sort of moving in this nice prescriptive fashion. And so it's important to debunk these 5 stages. So we see the stages as being denial, anger, bargaining, depression, and acceptance. And so you sometimes will get people thinking that it should go in this nice little order, and helping people know with psychoeducation that that's not the fact is important. And so we know that these stages can happen, but not necessarily in that order, because grief is not linear, right? So you might find bargaining, you might find anger, you might find acceptance, you might find these things with a host of a bunch of other things too. And so really it just depends on the person you lost, what your coping styles were before the loss, what your support was like before the loss. All of these factors will impact sort of the different phases that you touch or experience along the way in the mourning process. And so to think about grief and loss, I really like to take it back to attachment theory, because this is really the heart and soul of grief work. So when we think about attachments, we are hardwired to seek proximity to others, right? Like we are designed to connect and form strong attachments with people. And when we form these strong attachments with people, they sort of become part of our internal world and sort of part of our internal homeostasis. And so when we lose that attachment figure and that person is not coming back, our whole internal world, our whole internal physiology and homeostasis becomes completely disrupted. And so our ability to sort of function and, operate in a normal fashion is not possible. And so we really want people to understand that there's a lot of things happening internally that are beyond our control. And so it takes some time when we lose a major attachment figure to help re-regulate our internal world and find a new level of homeostasis and internal sort of regulation. And so it's really helpful for us to sort of think about this as a basic premise as we're thinking about grief and loss. And so also thinking about grief is a stress response. So the loss of someone close to us can be one of the most severe stressors that we can face in our lives, and it can bring many challenges. So there's a range of stressful responses that we can have. So we might be struggling with the loss of companionship, the sense of protection that relationship gave us, a sense of self, aspects of our own personal and social identity. So if we lost a child, we might lose our role as like a mother in the mom group. If we lost a partner, we might be struggling with our identity as a couple and no longer being invited to, couples things, or struggling when we go to things that have lots of couples and now we no longer feel as though we fit in. We can struggle with our sense of stability. If you lose a parent, there is a feeling that many of us have that parents sort of can tether us into our own life. And there's sort of always that feeling of knowing our parents will be there for us if we have a challenge or a struggle. And when we lose that stability, it can really feel dysregulating. And then also there's the loss of a caregiver role. So whether it be you have a child and you play the caregiver role for them, or you are a caregiver for somebody with, say, Alzheimer's and dementia, which we're going to talk about later, there is some meaning that comes with being a caregiver in that role. And the loss of that role can be really difficult. And then we also might struggle with other restoration-related stresses. So there can be family dynamic challenges. We can get excluded from social groups, difficulty meeting responsibilities, and certainly difficulty and uncertainty about the future. Who am I? What does the future look like? Maybe I'm having financial challenges now. Maybe I don't know how to pay bills on my own. My husband always did that for me. So there's all of these things that can become difficult. I don't know how to pay the bills. I don't know how to take out the garbage. I don't even know where my health insurance card is. So there's all these other factors that can add to the stress response when we lose someone we love. And so the experience of grief, like the responses and the thoughts that we have, can also add to the stress. So it's not unusual for grievers to have very confusing thoughts and mixed feelings. For example, wanting the grief to go away, but also wanting to hold on to it. Feeling like I don't want this suffering, but believing if I let go of the suffering, I'm letting go of the person I love. Wanting to be free of the pain, but also feeling like I should be in pain. Like, what does it say about me if I'm no longer suffering? I feel like I should hold on to this suffering because It's a show to the world and to myself that that person I loved really mattered. Wanting to move on with things, but not wanting to, feeling the need for other people, but finding it hard to connect, knowing that the loss is real, but having trouble like actually really believing it's real, having magical thinking, craving closest to the person that we lost, but maybe wanting to avoid reminders, avoiding photos, avoiding things that remind us of them because it's just the connection to the fact that they're no longer here, and maybe that's difficult. And so all of these confusing factors can add to the stress response that we have when we lose someone we love. So it's a really complicating experience to go through. And so in time, what we want to do is find a way to adapt to this new reality, right? Doesn't mean we like the new reality. Doesn't mean we're okay with the new reality, but somehow finding a way to adapt and live in this new reality. And so we want to sort of oscillate between two different places, accepting this new reality and all that it means, and restoring our capacity for well-being. And so by doing that, it takes a number of things for us to do. And all of these things, again, happen throughout the mourning process, coming to terms with the finality of the loss and what that means. For many of us, we do not want to come to terms with the finality of the loss. We will do all that we can to avoid the finality of the loss. And so that's a really difficult piece. Recognizing that there's a changed relationship to the person that we lost. They now sort of hold a space in a different way now. They're not here in the physical world, but they are here in a different way within us. And sort of restoring our capacity for well-being is figuring out that there are possibilities for purpose and meaning, joy, and satisfaction. And for many grievers, especially those with prolonged grief, they really struggle with this one. The idea that like they can enjoy life again, that they can feel purpose again, that they can feel meaning again. This is a really difficult concept for those with prolonged grief. And actually, at times they could get upset with you. Like, how dare you think that I could have meaning again? How dare you think that I could have purpose again? So it is this really delicate line for grievers. And we want to help them sort of understand a sense of competence again, like I can pay those bills on my own. I can find a way to learn how to get my health insurance set. Like I can figure out some of these things on my own. And what does it do for me when I can have that competence? And then figuring out ways to engage in other satisfying and meaningful relationships. So when we can accept the reality of the loss, we can figure out a capacity to thrive. And then grief is transformed and integrated. And so when it's integrated, what does that look like? Well, it doesn't mean that grief is gone. In fact, grief will still come up. We will still feel intense emotions at times. Anniversaries, holidays, birthdays, these can still be difficult. A song on the radio can be difficult. It doesn't mean that grief is gone. It's just transformed and integrated in a way that we can now live with. It finds a place in our life. Our physiology is now re-regulated. The intense thoughts and memories start to recede. And now we can form a connection with our loved one in a way that feels more connected and meaningful, and not this stabbing hard pain. Emotions become bittersweet. At the beginning, they're just bitter. Now they're bittersweet and more regulated. And then we can find a way to reconnect with others. But as I stated earlier, it's important to know that even when grief is integrated, it is not always quiet and it is not gone. So this is just a little infographic on grief in the mourning process. So you start with bereavement. Generally, it moves to acute grief. Sometimes we have these pause points, which are defensive coping mechanisms that maybe sort of help us detach from the grief a little bit. And eventually we move into this stage where we're adapting to the change, accepting the reality, restoring our capacity to thrive, and move into integrated grief. But for those folks who develop prolonged grief, there's generally something that gets in the way of moving to that last stage, which is integration. And what we call those is our derailers. So we develop these sort of stuck points that in time become derailers. And generally, if you think about it, like that train track there, it's like the mourning process, you're going through it, you're on like a train, and something has derailed that train car, and it's got us on a side and it's turning indefinitely. And so what we want to do is to help sort of identify what are the things that derailed the person and have got them stuck. What are the things that maybe are bothering them about the loss, that are difficult for them, that are sort of getting them derailed, get them back on and move them through the mourning process. But for those who derail, they can stay stuck there in this heightened state of acute grief, like I said before, 5, 10, 15, 20 years. And so this is what prolonged grief's infographic looks like. So essentially, we get stuck in this middle stage here where the acute grief stays heightened and we are unable to move into this right-hand side here where the adaptation happens and we move into integrated grief. And this leads us to what prolonged grief disorder is. So for those of you, prolonged grief disorder entered into the DSM in March of 2022. And so this is prolonged grief disorder happens when we lose someone close and we experience intense yearning, longing, preoccupation with the deceased person, and the bereavement lasts longer than what social norms would expect and causes distress and problems with functioning. And so I'm going to go through real quick here the diagnostic piece. So when we're looking to diagnose, we are looking for the death of a person close to us is at least 12 months since the loss. And when I'm looking at other types of losses, say the loss of a child, it's unusual to think that someone would be integrated by 1 year. So you really want to look at the context of the loss. But for purposes of diagnosing, we need at least 12 months since the loss. And then we also are looking for persistent, pervasive, longing, preoccupation with the deceased. And then since the death, at least 3 of the following have been present most days, clinically significant nearly every day for at least 3 months. So you're looking at disrupted identity, marked sense of disbelief, avoidance of reminders, intense emotional pain, difficulty engaging in life, emotional numbness, feeling that life is meaningless, and intense loneliness. And then also you're going to be noticing significant distress or impairment in personal, family, social, educational, occupational, or other important areas of functioning. And the duration and severity exceeds expected norms. So I know that that's sort of a lot to throw out at you in one slide, but these are all very common things we see in people with prolonged grief disorder. And so why do some people develop prolonged grief disorder and others don't? We actually do not know. We're guessing that roughly 5 to 7% of those who lose someone go on to develop prolonged grief disorder. So I know that that number sounds small, but when you think about how many people lose someone a year, 5 to 7%, 7 to 10% is not that small. And so while we don't exactly know why some develop prolonged grief while others don't, we do know that there are some risk factors that can increase the chances of adaptation getting derailed and can be common in those who develop prolonged grief. So some individual variables, a history of depression, anxiety, trauma, or difficult relationships with early caregivers. So challenges with attachment styles. Also the relationships with deceased. So who died? How close were you? Was it identity defying? Was there a secure relationship in context with insecure attachments? And then also those who were caregivers of someone with Alzheimer's or dementia also are at risk. Of course, the circumstances of the death matter. So how old was the person when they died and how they died? So those who've lost someone to suicide, homicide, or another violent death are at higher risk of developing prolonged grief. And then also the context for the grief, right? So what else is going on in the bereaved person's life? Were they already struggling before the loss? Were they having challenges with income, need to move, social connections? All of these things are things that we notice and see as risk factors for people with prolonged grief. And so let's talk a little bit about caregivers and prolonged grief. And so what we know about caregivers of those with Alzheimer's and dementia is that in general, family members who are involved in caregiving show remarkable resilience and adapt to the death of their loved one. So, by and large, people do great, but there is a small subset. And in fact, it's not that small. So what some studies are showing is roughly between 10 and 20%. Studies have shown that dementia caregivers are at higher risk of developing prolonged grief, with an estimated 10 to 20% of bereaved caregivers developing prolonged grief. So that number is not small, especially when you think about how many millions of people in the United States alone. I think it's something like 15 million family caregivers alone in the United States. So 10 to 20%, that's a pretty big number. And so when we think about caregivers of dementia and Alzheimer's, we know that there are a few things that we see grief patterns with those. Okay, so there's two common things that we see, which is ambiguous grief and anticipatory grief. So I'm sure that you've all heard about these already before, but I just wanted to note about them. Ambiguous grief, this is the tough one. Ambiguous loss is the type of loss you feel when the person with dementia is physically here, but they're not mentally or physically present anymore in the same way. And so you're sort of grieving something that is still here, but is no longer here in the way that you know it or are used to. And so this can be very different for other types of losses, right? When we have a sudden loss, we're not dealing with this sort of ambiguity. It's very clear the loss happens, but with this one, there is this sort of gradual thing where like they're still here, but we are aware that life is not the same anymore. And then anticipatory grief is when we have sort of this feeling of grieving the life we had and grieving all the aspects of it, and sort of this drawn out piece that happens before the loss actually happens. And what's interesting about anticipatory grief is I think that so many of us that haven't been through the caregiver experience maybe falsely believe that because those who are caregivers of Alzheimer's dementia maybe have a longer runway before they lose their loved one, that perhaps they have more time to sort of prepare for the loss. And what you hear anecdotally time and time again is that actually, despite the fact that maybe they've known for a really long time that they're going to lose their loved one, nothing prepared them for the reality when they were actually gone. And so there's this sort of belief that like, oh, you should have, you know, oh, I'm sure they're fine now. When in fact, that's not always the case with caregivers. And so we do know that there are some factors associated with negative bereavement outcomes in caregivers. And so negative bereavement outcomes would be difficulty functioning, mental health challenges, physical health challenges, and whatnot. So what are some of the factors that we see in challenges that caregivers face? Well, we know that a risk factor is, or you know, what makes it more likely to have some challenges is being married to the person who died, the person you were caring for, those who derived benefit from the caregiving experience. So of course, we know that there is a high caregiver burden and a lot that of stressors associated with caregiving, of course. But two things can exist at once. It can be really difficult and challenging, and there also can be a sense of meaning and purpose and pride that can go along with caring for our loved one. And for those people who really found some form of benefit, even in all the stress, it can make it really difficult after they lose their loved one. If you had a compromised physical or mental health status before the death, that's going to make it even more difficult. The trauma of witnessing a long-term dying process, that might weigh on some people. And then, believe it or not, this piece here, low preparedness for the impending death. And so what we find again is that even though people have known in some cases for 5, 10 years that their loved one has dementia, is going to be dying, they still will say they did not feel prepared, like nothing prepared them for that reality. Now, of course, that's not across the board. There's many people that did feel prepared, but it's not unusual to hear this piece, that people felt like they weren't prepared. And so looking at a little bit on the data of what we see with predictors of prolonged grief in caregivers. So here's a study, one of the first studies that looked at the predictors of prolonged grief in caregivers. This was done in 2006. And it was pulled from a sample, the multi-site REACH study, which many of you are probably familiar with, the Alzheimer's Caregivers Health Study, a large multi-site study of over 1,200 people. And in that study, they looked at over 217 caregivers who lost their loved one during the study, and followed them to see if they developed complicated grief at the time. It's now prolonged grief. And in this study, they found that 20% of the folks that lost someone during the study developed prolonged grief. And then they went ahead to look at what the risk factors were. So the people who did those 20%, what were their risk factors? So those who had high levels of caregiver burden during their experience of caregiving was a risk factor. Again, a history of depression and anxiety during the caregiving. So that was a real challenge. We're seeing that across the board. Again, the deriving benefit from the role. And also, what was interesting was patient impairment level. So those who had higher cognitive abilities, that was more challenging for the caregivers. And I'm guessing because they still, when they lost their loved one, they still were high enough functioning that the loss of their loved one was maybe a little more difficult for them. And so this study was one of the first ones that looked at this in 2006, and it's been replicated in other cohorts and been published as well. So this is a very common thing that we're seeing now. Somewhere between 20% of those who caregive develop prolonged grief. So I'm going to be covering now prolonged grief disorder therapy. So we now know that there's, percentage of people who develop prolonged grief that are caregivers. We know that some of the things that maybe make a risk for them is depression, anxiety during it, caregiver burden, meaning and roles, and that. And so the gold standard for treating prolonged grief is prolonged grief disorder therapy. This was developed through Dr. Kathy Shear, who is at the Center for Prolonged Grief at Columbia. And she's been studying prolonged grief and has put this therapy together for almost 30 years now. It's a really highly effective form of therapy. It's a 16-week manualized therapy and includes 7 milestones or themes that are introduced sequentially. And each is associated with a specific procedure. And these themes and milestones are used to achieve certain goals throughout, all really designed to help people come to terms with the reality. So here's some data from some of the studies that she's published. This is actually from 3 of her studies, looking at 641 participants, aged 20 to 93, bereaved from a range of losses by natural and violent causes. This does not weed out just the caregivers, unfortunately, but this is just a way for me to show you the effectiveness of this therapy. So what we found was compared to the control, which was IPT, interpersonal therapy and medication, 71% of those who got prolonged grief disorder therapy had improvements. So it's a very effective form of therapy, and it's been highly published. And I will just share with you anecdotally that I have seen it improve the lives of every single person I have ever done the therapy with. So it's highly intensive, but it's really designed to help people integrate the loss and come to terms with the reality. And the 16-week structure is really helpful for grievers because they feel as though they've been grieving for so long. And when you tell them 16 weeks, it makes them feel like, okay, this is an idea and understanding that I can wrap my head around, and it's time limited, which is nice as well. So going back to this infographic, really what prolonged grief disorder therapy is to do is to provide effective support, facilitate adapting to the loss, and identify stuck points, the things that got people derailed, and get them back on track. So it's really targeting all of this area here where people in prolonged grief get stuck. And so when we think about caregivers and some of their derailers, there are lots of different things that can derail caregivers, right? But sometimes we see things like loneliness, blame. I see a lot of times like blaming themselves, blaming others, like that person didn't give my loved one the care, or I made that one decision and I wish I never did that decision. And they sort of can get derailed over and over again on what people did or did not do. And then also anger can be another derailer for caregivers. Now, there are many other derailers too. I'm just throwing out a few examples of derailers that we see with caregivers. Anger, again, at themselves, at the care they got, at what the facility did or did not do, what that caregiver at the facility did or did not do when they, were in the hospital for a little bit of time. So there's various things that can derail a caregiver, and these are just some examples. And so when we're doing prolonged grief disorder therapy, we're focusing on these milestones. We want to help people understand and accept their grief. We want to help them manage emotions, see a promising future, strengthen relationships, narrate the story of the death, learn to live with reminders, and connect with memories of the people who died. So that's a lot to do in 16 weeks. And so the way that we do it is that each one of those milestones is associated with a specific procedure. So I'm actually going to forward to each one of these so that we can go through them one by one. And I don't have that many more slides. So the first thing is understanding and accepting your grief. We can become so overwhelmed with our grief. It can be so difficult to manage. And we want to help with psychoeducation to help people understand their grief, help them make sense of it, and help them really understand their grief reactions and learn to accept them. Because so many people, this is the first time they've gone through something like this. And so we want to help them really understand what's happening with them and help validate and normalize the experience. We want to help them learn to manage their emotional pain. This is big. Grieving clients are often overwhelmed by their emotions and are seeking help to manage their grief. They're looking to avoid their grief. They're looking to deal with it in all kinds of ways. So we use active listening to help our clients feel safe, experience and express emotions, help them understand them, name them. And then we also do what we call is a grief monitoring, where we have them track them on a daily basis. We have them do this all throughout the 16 weeks as a way to better understand their grief. What are their things that are activating their grief? What are the things that make it a little easier? What are the things that make it harder? And so this is a way for people to reflect on a daily basis and be curious about their grief. We're going to be talking about the death. We're going to be talking about it regularly. And so if you think about the loss of our loved one, like that is the biggest moment, is the moment we learn that the person we love died. And so what we're going to do is we're going to help them tell the story of that loss over and over again, almost like the form of exposure therapy, week after week. And we're going to help them narrate the story of the death and help make the unthinkable thinkable. And we're going to ask them to tape it, listen to it at home, and then we're going to come back to it next week and we're going to do it again. And this can really help with stuck points here, like the persistent and strong disbeliefs, the counterfactual thinking, and like the repeating the story over and over again, and being able to tolerate that story and maybe reflect on that story and look at it differently week after week helps take something that is so unmanageable and in time feel far more manageable. We are going to help them see a promising future. Most folks with prolonged grief really struggle with this. And so we want to help them re-engage in interests and hobbies, develop goals, and work on those goals on a weekly basis. And this is a difficult one for them because they don't have interest. They don't want to have interest. They're upset with you for even thinking about it. So this is a delicate act. But time and time again, I see people come to life in time as they start to re-engage with who made them before the loss. Who were they before they started caregiving? Tell me more about you. What was your life like? What did you enjoy? Like, let me understand who you are. And often as they start to narrate the story of who they were before all this pain and suffering, they just start to light up and they can connect to this like spark within them. And once you can get them to connect with the spark, and then once you can get them to do it twice. And so this is something we do week after week, is sort of working on goal setting. We sometimes start with really big goals and just take steps, baby steps, week after week towards helping them do those things. We want to help them strengthen relationships. Many times bereavement robs us of a sense of belonging. And so we want to help people connect to others and restore and nurture connections with people if they have that desire. Some people just, it's not for them, that's okay. We want to help them live in a world of reminders. Reminders are everywhere, right? We drive down the street. Maybe we drive by the place where we once did that thing with our loved one, or maybe we drive by the doctor's office where we used to have to go time and time again, or we just see photos in the house, or birthdays, holidays, anniversaries. So we want to help people learn to live with those and not have to avoid them and to be able to tolerate them. And so we are going to be sort of looking at the things that people have been avoiding since the loss, and helping to guide them towards being able to do those things again or engage in those things again. Because the more things we avoid, the more it maintains pain. And if we can help people sort of one by one be able to work through those things, we're going to help them sort of work towards not feeling as stuck and being more free in their world to sort of move about. And I just have a few more slides. We want to help people connect to the memories of people who died. So we have a series of memory forms that allow us to re-engage positive memories and negative memories, especially for caregivers. There are some negative memories that they have. I've had a client tell me about how right before her dad died, he was so paranoid and thought that that she stole money from him, and he was so angry and was berating her and all of these things, and how painful that was for her at the end, that was like her final memory, was that dad believed that she had stolen from him and all of these things. And so we had to sort of work through not just the positive memories and like this joyful life that had together, but also some of the painful things that happened at the end. And so sort of being able to work through, touch those things and put it away, touch the painful things and then put it away and touch the positive things, to be able to do both. And, using these milestones, so I just went through the 7 milestones in record time, but we can use these milestones when we're thinking about the fact that, like many of the caregivers who had these risk factors, they came during their time when they were caregiving, right? So how can we think about ways that we can support caregivers when they're caregiving? So perhaps they will be better equipped after the loss. So we can use these milestones when they are caregiving, before the losses. Help them utilize the milestones to help them cope with the anticipatory loss, maybe helping them so that they feel more prepared when the loss happens, so they don't feel like they weren't prepared. Using reflection on the impact of the loss and what it means for them, acknowledging a range of emotions and encouraging and engaging in rewards and self-care, really making sure we're going to help people get the care they need during the caregiving process. And I know I'm preaching to the choir because we all know how difficult it is for caregivers to get support and care during the caregiving process. Help them think about the future without the person in it, and maintaining connections to others, which can be really difficult for caregivers too. And so my final slide is just the need to support caregivers before the loss is critical. We all know this. One of the things that I'm proud to share with all of you is at the Stein Institute, we developed a 6-week program to enhance resilience, empathy, compassion, and self-compassion. We have published, we've done it in a number of different cohorts, and we recently developed it for caregivers of Alzheimer's and dementia, as a way to sort of help support them during the caregiving process, and maybe help, prevent them from developing prolonged grief after their loss. And so this is something that we've done in senior living communities. So Christina, that's one of the projects we did with V, not caregiver related, but that was just to enhance resilience in older adults. But we have also adapted the manual to be able to be done with caregivers as well, because we know how important it is to support caregivers, because caregiver burden and the impact on mental health and physical health is just astronomical. So I went through all of that really fast. With that, thank you so much.